Treatment for colon cancer depends on a variety of factors, including the stage of the cancer, the location of the tumor, the patient's overall health, and personal preferences. Treatment options typically include surgery, chemotherapy, radiation therapy, targeted therapy, and immunotherapy. An overview of these treatments follows. Surgery. The primary treatment for localized colon cancer is surgery. This involves removing the tumor and surrounding healthy tissue. The extent of surgery may vary depending on the size and location of the tumor. For early-stage colon cancer, the recovery period can be shortened through minimally invasive surgery such as laparoscopy or robotic surgery. In some cases, a colostomy or ileostomy may be necessary, in which part of the colon or rectum is brought to the surface of the abdomen to create a stoma. Chemotherapy. Chemotherapy involves using drugs to kill cancer cells or stop their growth. It is often used in conjunction with surgery before or after surgery to reduce the risk of cancer recurrence. In more advanced cases, chemotherapy may be used to control the spread of the cancer. Radiotherapeutics. Radiation therapy uses high-energy rays to destroy or damage cancer cells. It is often used to shrink tumors before surgery or to remove remaining cancer cells after surgery. External beam radiation and internal radiation therapy, brachytherapy, may be used. Targeted treatment. Targeted therapy is a drug that specifically targets a specific protein or pathway in cancer cells. These drugs may be used if you have certain genetic mutations or alterations. Common targeted treatments for colorectal cancer include cetuximab and panitumumab. Immunotherapy. Immunotherapy works by strengthening the body's immune system to recognize and attack cancer cells. Immune checkpoint inhibitors, such as pembrolizumab and nivolumab, are used in certain cases of colon cancer, especially those with certain genetic characteristics. Clinical trials. Clinical trials can provide access to experimental treatments and treatments that are not yet widely available. Participation in clinical trials should be considered, especially in cases of advanced colorectal cancer. Palliative care. Palliative care is an essential component of colorectal cancer treatment. The focus is on alleviating symptoms, managing side effects, and improving patients' quality of life. It can be used in conjunction with therapeutic treatment. Most asked questions about colorectal cancer treatment. What are the common treatment options for colorectal cancer? Common treatment options include surgery, chemotherapy, radiation therapy, targeted therapy, immunotherapy, and palliative care. How is the stage of colorectal cancer determined, and why is it important for treatment? The stage of cancer is determined based on the size of the tumor, its extent of spread, and whether it has affected nearby lymph nodes or distant organs. Staging helps determine the most appropriate treatment plan. What is the role of surgery in treating colorectal cancer? Surgery is often used to remove the tumor and surrounding tissue. Depending on the tumor's location and stage, it may involve a partial colectomy, rectal resection, or a colostomy, ileostomy. When is chemotherapy used in colorectal cancer treatment? Chemotherapy is used to kill cancer cells or reduce their growth. It may be used before or after surgery, as well as in advanced cases to control cancer spread. What is the purpose of radiation therapy in colorectal cancer treatment? Radiation therapy uses high-energy rays to shrink tumors before surgery or eliminate remaining cancer cells after surgery. It can be combined with other treatments. How do targeted therapies work in treating colorectal cancer? Targeted therapies specifically target proteins or pathways in cancer cells. They are used when specific genetic mutations are present, such as with drugs like cetuximab and panitumumab. What is immunotherapy, and when is it used in colorectal cancer treatment? Immunotherapy enhances the body's immune system to attack cancer cells. It is used in certain colorectal cancer cases, often with specific genetic features, using drugs like pembrolizumab and nivolumab. Are there clinical trials available for colorectal cancer treatment, and should I consider them? Clinical trials offer access to experimental treatments. Consider discussing clinical trial options with your healthcare team, especially if standard treatments are not effective. What is palliative care, and when is it introduced in colorectal cancer treatment? Palliative care focuses on symptom management, pain relief, and improving quality of life. It can be introduced at any stage of treatment, alongside curative approaches.